head back for me. Head straight down for me. Good. Now tuck your chin. Good. Good. You come in once a month, right? And you get treated usually where you're coming in with some neck stiffness, tension in your upper back. Yeah. It helps you kind of relieve some of that tension and pain, keeps you active with work. You're a nurse at GBMC, not at Hopkins.
Right.
Rival.
A little bit.
A little bit?
Yeah, we're by ourselves, so we have to like fight for our
You don't have mega
independence.
campuses all over Baltimore?
No.
Yeah, I got you.
We're a baby hospital.
It's where I was born. Speaking of babies, GBMC.
It's a great hospital. Come visit if you need to.
If you need to. Only if you need to.
Yes.
Definitely go there if you need to.
If you need to.
So you come in once a month, helps out with your discomfort. What do you do over at GBMC if you don't mind me asking?
I'm an ER nurse.
You're an ER nurse? Nice. And how long have you been an ER nurse for? 7
years.
Right.
Yeah.
That's a long time.
It is.
You're teaching other people. I hear through the grapevine of other nurses from GBMC that you're a certified teacher over there.
Yeah, I'm in leadership, so I try to teach new processes and help things move a little more smoothly.
Right on.
In the ER, yeah.
Cool, that's awesome. So she's passionate about what she does. Naturally, she's a good teacher, and so those two coupled together, you create other great nurses around you, honestly, and through your leadership, I'm sure that helps too. And then you wear a Scooby-Doo mask, which brings a lot of...
Beatles!
Oh, right, Beatles. No, I'm committed to Scooby-Doo. And so I'm sure that brings a little joy to the place too. So really grateful that Katie comes in to see us and is our patient here. And so I'm excited to take you through an exam now and adjust you, do some soft tissue work with you. I'm going to focus on the neck area and then go forward from there, okay? Yeah, take the kimono off. There you go, walk over towards me. Relax. You do any camping, hiking last weekend?
A little mini hike.
Mini hike?
Yep, I'm in Jersey.
What's a mini hike? How many miles?
I don't know. He didn't have his watch on, so he didn't even count, really.
That does not even exist.
Right.
That never happened.
Right.
No data to track it.
Didn't even happen.
You're not even
it's
a
like
hiker.
Ghost walk.
You're a fake mini hiker.
Pretty much.
Oh, gotcha. Okay. All right, relax for me. I'm going to see you turn your head to your right as far as you can comfortably go. And then come to your left side for me. Good. And go ahead and sit up nice and tall. I want you to do that again. As far as you can go to the right for me. Good. And come to this side for me nice and slow. Good. 30 degrees right rotation, 45 degrees left. Go ahead and face me. Bring your head back for me. Good. I'm going to rotate you here. Any pain or discomfort when I bring you into this position?
No, it just isn't going to move.
Feels stiff?
Uh-huh.
Yeah. Does it feel stiff here too?
Yeah, that's pulling more.
Pulling more? Where does it pull more?
Like in here.
Yeah. And bring your chin down for me. Any pain or discomfort with that?
No.
So left-sided compression, cervical spine, right-sided tension. And then go ahead and bring your head back again for me. Good. 3 fingers extension, full range of motion flexion. Right trap plus, right levator scap plus. What's up? You're moving this around?
Yeah.
You want me to touch it? Work on it?
Yeah.
Yeah. Is that bothering you?
Like, it just gets all stiff. Like, the entire upper back just feels stiff. But this one feels like...
Stiffer?
Yeah.
Gotcha. Yeah, that right
Or
shoulder.
like, there's like crepitus when I move it.
Yeah, and I think that it comes from a couple of reasons. So why does your shoulder click and pop? A couple of reasons, right? The scapula sits on the thoracic cage, and when you're moving it around, there's a possibility of some crepitus underneath of it, right? Now that's common. We see that a lot, right? And that can come with a lot of use of the shoulders, use of the hands, like you probably do with work. Another reason that can happen is tension around the muscles that support the scapula. So the scapula is this free-floating bone on your thoracic cage. There's no bony attachments to the body, right? It's only muscular attachments that ground it down, right? And so the muscles that help support it all around it, like the levator scap that comes off the corner, right? That rhomboid muscle that helps keep it flat against your thoracic cage. Sometimes when there's tension in those muscles, you'll feel a little bit of like crepitus or popping because of the tension of the muscles around bony parts. Nothing wrong with that. It just is what it is, okay? In most cases, that's where you'll hear popping or crepitus. It's a scary sounding word that we create, right? But it's just a little tension in the shoulder, okay? So let's get you loosened up a little bit. She has no neurological symptoms except for when you're on your switch at night.
Paresthesia.
Yeah, delete those apps. Get rid of them. It might go away a little bit more. So a lot of people that spend a lot of time here playing on the switch or what have you, there's a little bit of compression in this flexor group, and then where the nerves come into the hand to help move your hand and feel, there's a little compression on it. Just imagine if you hit your funny bone, it's a quick shot. Imagine if you just compress that nerve for a little while. It's a little bit more of like a paresthesia, slower progression of tingling. All right, Scooby-Doo mask, sit here for me.
Okay.
Yep. And she's got a good shirt on for me to do the soft tissue work on her shoulder. I think that she's a chiropractic vet when it comes to that. So mini hiking, huh?
Yeah.
Tender. Here? Or up here?
I don't know. Like there.
Yeah. So working down below the levator scap, a little tension here, but really a lot of her tension exists in this rhomboid group that sits up right below it, right? So now for rhomboid muscles plus. And I'm just gonna watch you move the shoulder, okay? Reach your hands straight up to the ceiling for me. Good. I want to feel how her joint here is moving, but also the scapula should swing too. Go ahead.
Like that feels weird in these two fingers. Just having my arm outstretched like this.
Go like this for me and do like a brush stroke and pull. Does that feel weirder?
Yeah.
Does it feel like a lot of pulling sensation? Okay, and then go like this. Come here and pull it back. Does that feel weird?
I don't think so.
No. Okay, and go like this and open.
Yeah.
Where?
It's like here and here.
Okay.
But
So a lot of
like,
times
it's like yeah, it's like weird.
like a pulling sensation, almost like a little nervy at the end.
Yeah.
Yeah, just tension along that side. So your brachial plexus here comes down, innervates this hand, right? When you have tension in the shoulder girdle, the neck, and you've had a history of some neuro complaints. Maybe I started here 2 years ago. It's been 2 years.
Yeah, I started like probably 2 months before you or
So
something.
right around the same time. It's been 2 years. And we've survived. And it's been a lot of fun. But yeah, so you came in with like a little bit more of a serious complaint, a little bit of ridiculosity.
Yeah, it was a lot worse.
A lot worse.
Yeah. And I was coming in 3 times a week then.
Yes. And it was a little bit more significant in terms of the amount of pain you're in, right? We got on top of that, so there's still a little bit of lingering tension in that forearm and this whole shoulder girdle area and the neck. So I'm going to focus on doing a little soft tissue clearing, and I'll stop talking now. I'll start working on her so she can get back to doing her thing. Natalie, positive neurotension sign, radial. And you just put that at the bottom right corner. Okay. Negative for ulna. Positive for median. Okay. And relax here for me. All right. You're gonna bring your head back for me, and head straight down. Okay. Head back. And down. Breathe. And exhale. Are you comfortable sitting on the table like this? Head back. Lift your chest up. Good. Head down. Natalie, do me a favor. Go ahead and grab her chart for me. I'm going to scribe with you. Turn your head to your left. Tuck your chin. Head back for me. Head straight down for me. Good. Now you do the reaching head back, head down, and you're going to reach your hand across your body for me, okay? Good, breathe in, exhale. Good. Head back, head down, easy. Reach. Pressure, breathe in, exhale. Good. Now relax. Bring your hand out like this. Good. You're gonna feel pressure right in this area, okay? Roll this hand through, put it in your back left pocket. Good. There you go. And take your head down for me. Good. Turn your head to your left. Breathe. And then relax your face muscles. Let that drop. Good. Let me know if my pressure's too strong. Okay. Bring your hand back out for me. Fix your Scooby-Doo mat. Hand behind your back. Did you like the show Scooby-Doo? Is that why you picked it?
No, I liked it because I got like the Beatles.
You like Beatles, huh?
Yeah.
Okay.
It says all you need is love.
Bring your hand.
70s band and everything.
Love, peace, and joy, huh?
Yeah.
We need some of that.
Peace, love, and rock and roll, man.
Let's go, man. Yeah, man. Come on over here with that hand, man. Put that there. Here you go. Good. Head down for me. And breathe. Exhale, easy. STR with active range of motion. Right supraspinatus. Right rhomboid. And scalenes, okay? Go ahead again. Get pressure here. Breathe in. Exhale. It looks great there.
Yeah, that's from my height.
Proof.
Uh-huh.
Proof.
The injury.
The injury is a proof.
Yeah.
Go ahead, roll down. Get a little more pressure here, okay? Head down for me. Good. Turn your head to your left. Tuck your chin. Good. Alright. And relax now. Okay. So we're really going to pull here as I bring you up, and I'm going to really scoop my hand behind your scapula, okay?
Mm-hmm.
Breathe in and let your shoulder relax. Relax here. What time do you have to go into work today?
Whenever I'm done here.
Gotcha. Relax.
I'm gonna get breakfast first, I think. I don't know where you can.
Cunningham's.
Is that close?
It's right down the street. They just opened back up.
Is it dine-in or take-out?
Take out. I don't think anyone can get down. Unless
Well, I
they
meant
don't
like,
use
is it like a diner or is it like a,
Oh,
like
it's a little
bagel
cafe.
place?
Yeah.
Oh, perfect.
Yeah, it's nice.
I'm gonna get
They have
coffee
good
too.
breakfast burritos there.
Perfect.
And they have really good coffee.
Is there parking?
Yes, across the street. Anything else you need today, Katie? Any other
Yeah,
stops you gotta
thank
go to?
you.
You're welcome.
One-stop shop.
One stop shop. Alright, easy. Breathe. A little sore. Head down for me. Good. Breathe in. And exhale. Easy. Let this drop. Let this drop. There you go. Good. Alright, you're gonna come onto your back for me, okay?
Uh-huh.
Yeah, nice no look back up there. That was impressive. So Natalie, we're going to do some soft tissue on the palmar fascia,
Okay.
the flexor group, okay? And then the scalenes as well. You already got that, okay?
Mm-hmm. Can I take the bracelet off?
No, you're okay. Keep that cool thing on. That's got to signify
So
something cool.
Yeah, I got it from the Amazon.com.
You had me for a second. From the Amazon. I want to go to the Amazon.
Yeah?
Yeah.
Of course you
I'm
do.
going to go to the Amazon.
And you're gonna fix all their backs over in the Amazon?
Do you want me to crack backs in the Amazon? Is that what you just said?
Yeah. Is that what you're gonna do?
Yeah, yeah, for sure. Why not? I'll travel and adjust people. I'm trying to plan a trip. My brother's gonna go talk about it. So I don't have all the details yet, but I want to do a trip abroad, like in a nice hotel in Nicaragua, where I'm treating people that are staying there, but also like creating like a health retreat with
cool.
it. Yeah. That way I can travel and do what I love and do what I love. So it's like a double win.
Yeah. That'd be awesome.
And then I'll just get a Scooby-Doo van and just kind of roll around it.
Sounds like the dream.
That's what I'm looking for. Alright, breathe for me. Exhale easy. when I was going through like the internship process, and my current fiance, but my girlfriend at the time was running a triathlon, and she was in the middle of it, and I was kind of hanging out, and I was talking about going down to South America. Like I was like, I'm going to Argentina to do my preceptorship, do it abroad, and there's possibilities of doing that, just harder. A lot of like random paperwork and just finding the right person down there. But there was a clinic in Santiago, Chile that was like amazing. I was like, all right, I'm going there for sure. No doubt about it in my mind. But I was working on it, and I met this woman while watching the race, and I started talking to her. Her great-grandpa was one of the first chiropractors in Argentina.
What?
And his grandpa was also a chiropractor that was
What are the chances of that?
in Argentina,
How
too.
random is that? That's awesome.
There's like 12 chiropractors in Argentina.
Yeah.
Super random.
Yeah.
And she was moving back there, and she invited us to stay with her, invited us like you can come here.
Oh
I've got my
gosh.
brother. Well, she has a rock climbing place in northwestern Argentina. Like that, there's a place her brother lived that was famous for rock climbing in northwestern Argentina. She's like, you can go there and stay with him and rock climb.
Are you gonna go?
I'm like, what? This is like what I've always wanted to do. But I didn't do it. I took the serious route, and I went to Walter Reed, and I worked in a hospital, and I kept saying to myself, what the heck am I doing here?
I could have been in Argentina.
Why do I listen to people? Follow your heart. And so the coolest thing about the guy that's the chiropractor in Argentina was that he was blind.
What? That's awesome.
The one for the national ballet team. Yeah, I thought so too.
I mean, it doesn't make sense. You should just be able to feel everything.
That's why I was like, I can sometimes close my eyes and work on people, right? Not all the time, but like sometimes I'm like just thinking with my hands, right? I can imagine that if they can get really good at what they do.
Oh, I'm sure.
It's probably amazing.
Yeah.
Probably the best chiropractor ever.
Probably. You just need to blind yourself.
That's it.
We found the secret.
Open your palm. Hands straight down for me. Good.
You're getting a lot of good B-roll here.
Tons of good B-roll. Look at you. You coming in? Watch out, Liam. You got some competition for your job right here.
Oh no.
Head down for me. Your hand down, sorry. Tender?
Yeah, I didn't like that.
You don't like that? Okay. Take it down a notch. Turn it down. Here you go. Breathe in. Exhale easy. This is all that Nintendo Switch gaming right here. Look at you gaming.
Playing Animal Crossing.
Animal Crossing? For hours.
Hours.
Follow your heart. Relax here. Relax. Hey Nat, will you just, especially if I'm okay right now, will you grab my soft tissue cream out of my office, and then I'll take care of the rest of this, so I appreciate you. She's awesome.
What is she?
She's amazing.
Is she like a student?
She is going on to PA school next year. She's trying to get in. And she works here as a clinical assistant. And she's just picking up like exam processes really fast and like onboarding for new employees. She's doing a great job.
Nice.
Yeah. Don't you love that?
Mm-hmm. Makes things much easier.
It does, and also it's like she has a sense of like purpose, and she's working hard, and she's a part of the process. You know what I mean? It's a win-win. It's not just about like making life easier for the docs, but it's like just giving you better care overall. How do we do that? My mindset always makes the right decisions.
You're
Cheers.
okay.
Thank you. Got the green light to hang out with you.
Sweet.
Sweet. I haven't done the soft tissue work with this on you in a minute. And so, it's not necessarily a massage that I'm doing, right? It's there's massage work involved, but it's soft tissue work on specific muscles, and I'm clinically treating that entrapment that she has in some of those nerves, why she's getting that numbness and tingling, that pulling sensation into her hand, right? So there's a lot of structure here under the armpit, and a lot of structure that's sensitive. There's a reason our body protects it here, right? And you can kind of see her jump from time to time. It is when I touch some of those sensitive structures, she in that position a little bit, which is normal. So subscapularis, the brachial plexus, as well as the lat, or some of the tissues in the tricep insertion that I work on in this position. Breathe in. Exhale, easy. There you go. Breathe in. Exhale, pressure right here. Let me know if it's too much. Okay, good. So that right there. It's kind of stringy. That's the brachial plexus. Here.
I can feel it in the fingers.
Yeah, good. Let me know if you feel too much in the fingers, okay? Rest. I got you. Now, don't watch this video and go start playing around with people's brachial plexus in their armpit, because you can seriously irritate someone's arm with it.
Really?
It's just sensitive. It's just it's nerve tissue that's exposed close to the skin. Yeah, and when you get an injury to the shoulder, there's a ton of guarding that occurs here. Like when I see like frozen shoulder, I'll spend a lot of time in this area, because like even the cartilage around the joint is starting to get tense and hasn't moved in a long time. You'll feel a fibrosis in that cartilage. That's true, frozen shoulder. But the muscles that exist here too are extremely hypertonic. Pressure. Breathe. Pressure. Good. Alright. Relax. Rest here. Good say.
We're having a little barbecue this weekend.
Are you?
Yeah.
Right on. That's so
Like
fun.
10 to 15 people. It's all people from work.
Sure. Yeah, big party. No, I'm just kidding. We're having a big party. The other aspects of that, right? There's nothing wrong with a good party.
It's nice things are starting to open back up.
Relax your head. I got you. Okay, relax here. You can feel a stretch on your neck, okay? Pressure, relax, stretch. Rest. Breathe in. Exhale.
Right there.
Yeah, no. Easy. Breathe. Exhale, let it go. Turn your head to your left. Breathe in. Exhale, easy. Loose, loose. You can kind of feel, you personally can feel how I can get a little deeper to that structure when these muscles start to let go a little bit, and now I can actually palpate on the joint itself and get down right to the edge. So here's your transverse process. Here's the edge of the transverse process. Here are the paraspinal muscles that exist between, and you feel how hypertonic that is. Yeah. Easy pressure. Tuck your chin. Rest. Easy. Tuck your chin. Good. Easy. Rotate. Good. All the way to the left. Tuck your chin.
I never know what to say to them when they first bring me in here. And they ask me what my chief complaint is. What am I supposed to say? 'Cause I don't... Because I say back pain and then they ask me a bunch of questions and I feel like I don't need to get into it because you know everything that's the story anyway.
Yeah, just on the level of your pain, where your majority of your pain is that day. Okay? Right? And then just tell them any recent complaints that have popped up. Any recent traumas, any recent hospitalizations, we need to know about that. Those kind of things. If it's just kind of the run-of-the-mill tune-up, you say, you know, I'm feeling really good, I'm just coming in for a checkup, I just want to get my spine looked at by the doctor. That's it. Turn your head this way. Rest your hand here. Reach and hold on to me.
Wait, my legs are up?
Yep. Reach and hold on to me. Breathe in. Exhale, easy, relax. Edge pressure. Good guardian. Let it go. Good. Easy. You're okay. Good. Oh, good job.
Not a good job.
You did a good job. Wait, I didn't do a good job?
No, me. I guard too much and I can't stop and it...
Turn your head this way. You didn't do it. It's fine. Yeah, all right. Reach across. I'm happy with what we got there. Reach across. Hold. Breathe. Exhale. Easy. Good. Good job. Not a good job. Can you tell she's hard on herself at work? You're not working right now, believe it or not. Rotate. Turn. Good. Turn. Loose. Good. Let your head rest on the table. Perfect. Good. Now turn your head towards me. Okay. A little tighter here. Let your shoulders drop.
Ah. That was a good one.
Yep. You did a great job. You did an awesome job. You relaxed so well, yeah.
On that one, I'm better at.
What would you grade yourself on that last one?
That last one was a 10 out of 10.
10 out of 10? Way to go. Good job. 10 out of 10. Nice. Let me just adjust your lower thoracic spine, okay?
Yeah.
Is that better? Yeah, so go ahead and face Liam. You just do that rotation again. You guys see how she opens up a little bit more now.
A lot. I can turn my right side a lot more.
Yeah. Still a little movement needs to happen there, but better. Come up on your stomach for me. Alright, you have to climb up. There you go. Nice job. 10 out of 10. Breathe in. Exhale. Easy. Breathe. Loose. Pressure. Nice and gentle. Good. Deep breath in. Let your shoulder blade drop. Hand drop to the floor. Breathe. Exhale. Breathe in. Exhale. Easy, I know. Relax.
Whatever that feels left up to.
What's that?
Whatever that is there.
There, right?
Yeah.
Come on your side, face me. I'm gonna adjust that area, but it's gonna be that side down. So here and here. Relax.
I'm not good at this one either.
There you are. You set yourself up like that, you're really gonna tighten up. Breathe in for me. Exhale, easy. I got you. Let your shoulders open. Focus on your back. I went back.
It's like that stretch feels like
a lot of pulling.
Yeah.
I try to keep you as compressed as I can because some people are like that because you're so mobile here in your ribs, so it probably feels like a lot of pulling in the rib cage as well as in the hip. So you just got to keep everything in a lot more compression than like a big stretch and adjustment. Basically, simple words. So stack your shoulders. Good. Breathe. Exhale. Easy. Is that okay? Good. Now tuck your chin. Better.
It's not pulling so much as like when I feel like I'm in that stretch, it feels like there's a lot of tension that needs to be released.
I got you. See, it's like a build-up.
Yeah, like I feel like I need to like stay like this with like a weight on it for like a half hour, and that would feel good.
Or just get adjusted in 5 seconds. One of the two.
Right.
Relax here. Loose. Whatever you prefer, though. Yeah.
Are my legs different lengths?
No, you're good.
Okay.
Just so you can watch this video later, come over here and look at Liam. So myofascially, right, you can have a structural change in the way that a leg appears in length. Kind of see how the heel of her foot lines up well. And I'll just give her a little bit of a tug to make sure she's lined up too. And she is. Because you're awesome. That's part of you being awesome. You're really balanced, right? You also do a lot of great job of working and teaching and having fun here. You're all good. So I'm gonna put a little ice on that just